Hello, and welcome to MedEvidence Articles, where we encourage community research and education with weekly articles. I'm your guest host, Rebecca Simpson, and this week we're talking about cochlear synaptopathy, also known as hidden hearing loss, a lesser-known form of hearing damage that can make understanding speech difficult even when standard hearing tests appear normal. Cochlear synaptopathy, the hidden form of hearing loss. Hearing loss is miserable, even though sometimes the construction crews next door make me consider the benefits. It is unfortunately common and affects many people worldwide. Actually, construction and other occupations are major drivers of hearing loss, with a significant portion of that loss linked to loud noise. Additionally, some medications and diseases can also damage hearing. Hearing loss affects around 1 in every 5 people, which is around 1.5 billion people worldwide. It disproportionately affects older people. Hearing loss often begins in people in their 40s, and more than 60% of those affected are over 50. Hearing loss doesn't just help you ignore jackhammers and backup alarms, it has also been identified as a major risk factor for tinnitus, which is the ringing or buzzing in your ears, and dementia. The way hearing works is really amazing. Sound waves compress air, which vibrates the eardrum. This converts the sound energy into mechanical vibrations that wiggle tiny hairs in the inner ear. As each hair wiggles, it sends a small signal to the brain, which interprets different patterns and distinct sounds. There are several types of hearing loss, and many involve damage to the hair cells, eardrums, middle ear structures, or the auditory nerve that carries signals to the brain. Cochlear synaptopathy is a common form of early hearing loss in which the link between inner ear hair cells and the auditory nerve is damaged. Cochlear synaptopathy, also called hidden hearing loss, is like a careless shovel crew digging into and damaging your internet cable at 2:46 p.m. on a workday before an important meeting while they're trying to expand your neighbor's driveway. The whole internet is still there, delivering ads and AI slop to kids around the world. Your laptop is still on, showing a small spinning loading icon and an error that says cannot connect to server, even though you hit refresh about 15 times a minute. All the equipment is in place, but the last leg of the connection isn't working. With cochlear synaptopathy, the ear hair is still working, and the nerve is still intact, but the last leg of the connection, the synapse, is damaged. This synapse is a particularly vulnerable part of the hearing pathway, and damage can be permanent. Cochlear synaptopathy is called hidden hearing loss because hearing tests can still show broad function and the hair cells are still intact, but many hearing tasks, like deciphering speech in a noisy room, can be extremely difficult. Luckily, new hope is emerging in this area through therapies being investigated in clinical trials. Neurotrophins are specialized hormones that stimulate nerve growth and have been investigated as potential treatments for Alzheimer's disease. That has not proved successful so far, but these small molecules may find a new home in treating cochlear synaptopathy. One medication in particular, palirodin, has entered phase 2 clinical trials and has been shown to repair synapses in animal models. This investigational medication is injected through the eardrum, where it activates neurotrophins in the ear that stimulate synapse regrowth and are theorized to help with hidden hearing loss. This kind of repurposing of previously unsuccessful medications is like finding out the lead shovelsmith next door has a fiber optic repair kit in their truck. This study is still in early phases, but if it proves successful, we may unearth the first disease-altering medication for hearing loss.
Thanks for joining us on this week's episode of MedEvidence Articles. If you'd like to know more, all of our sources are linked in the podcast description. You can also visit our website at medevidence.com and check out the MedEvidence podcast for discussions between physicians and subject matter experts. MedEvidence provides evidence-based information that empowers individuals to make informed health decisions. The organization stands apart in the presentation of unbiased clinical research in clear, accessible formats guided by medical experts. MedEvidence provides education for patients and healthcare professionals with a focus on research as a care option. Note that information provided in this podcast is for general educational, scientific, and informational purposes only and is not intended as and should not be treated as medical or other professional advice for any particular individual or individuals. If you are experiencing any medical issue or have any medical concerns, you should consult with a doctor or other medical professional. My name is Benton, and we'll catch you next week.